Welcome to Blue Glass channel. I am lab technician who is working in hospital and academic lab assistant. Today we are going to talk about high WBC count in your lab result. Your lab result came back and it is common to be asked that is there anything as a serious problem which has occurred to me or not? Is there anything very important or something like leukemia or other kinds of disease which has happened to me or not? Mostly your answer is no, because most of the time elevated WBC without any further information will show there is nothing as important problem. Just it is caused by some kinds of the infections, inflammation, or certain types of inflammation or certain types of medications. Because of that, we need further investigations, but it depends on your history and some kinds of the symptoms. Today we're talking about these kinds of possible criteria and situations which make your doctor suspicious about leukemia. And do not consider any forms of the WBC count which are elevated as a leukemia or serious disease. We need more investigations. And there is some kinds of the cases which are going to be explained to you. You will be fully understood about the important factors and symptoms which must make yourself to call to your doctor and visit your doctor in order to make sure there is nothing as important situation or a healthcare problem which has happened to you. Okay, let's start. A high WBC count is called leukocytosis. White blood cells are part of your immune system and help protect your body against infections and other threats. When your body is fighting an infection, it is completely normal for the WBC count to increase. For example, imagine a 25-year-old woman with a fever, sore throat, and a WBC count of 15,000. Her neutrophils are elevated and she is diagnosed with a bacterial infection. After treatment, her WBC count returns to normal. This is one of the most common situations we see in the lab. Now let's look at another case. A 40-year-old man undergoes surgery. 2 days later, his WBC count is 14,500. He has no weight loss, no night sweats, and no other concerning symptoms. In this situation, the elevated WBC count may simply be a normal response to physical stress and inflammation. So when do we become concerned? Let's look at another example. A 58-year-old man presents with fatigue for several months. He reports unintentional weight loss and frequent night sweats. His WBC count is 65,000 when a peripheral blood smear is examined. Immature white blood cells are present. This is a very different situation. At this point, further hematologic evaluation becomes necessary. But here is something important. Even a very high white blood count does not automatically mean leukemia. Consider this next case. A 32-year-old woman has a WBC count of 22,000 but feels completely well. Does she have leukemia? Not necessarily. Doctors need much more information before making that conclusion. This is why lab professionals look beyond the total WBC count. We evaluate the differential count, we examine the peripheral blood smear, and we review other lab findings. And we consider the patient's symptoms and medical history. In other words, a single number never tells the whole story. The most important message from this video is a high WBC count does not automatically mean leukemia. However, persistent elevation, very high counts of WBC, and abnormal blood smear findings, unexplained weight loss, and night sweats and persistent fever should never be ignored. One additional clue doctors look at is which white blood cell lineage is gonna increase. For example, a marked increase in neutrophils is most commonly associated with bacterial infections, inflammation, or stress. A significant increase in lymphocytes may be seen in certain viral infections, but it can also occur in some lymphoid leukemias, such as chronic lymphatic leukemia or CLL. Chronic, which means chronic lymphocytic leukemia. In myeloid leukemias, especially chronic myeloid leukemias or CML, lab professionals may observe increased granulocytic cells at different stages of maturation, including myelocytes and metamyelocytes. This is why the differential count and peripheral blood smear are so important. They help us determine whether the elevated WBC count is a normal reactive response or further hematologic investigations are going to be needed here. Doctors are not only interested in how many white blood counts are present, they also want to know which type of WBC is increasing. So if you found this video helpful, please give it a like and subscribe for more videos. If you have any suggestion or any forms of question, please write them in comments. I will read them, all of them one by one, and depends on your new suggestion, I will make new videos as soon as possible. Till the next time, take care.